Hello everyone, thank you for joining in this session. My name is Narila Mutia Nasir from Syarif Hidayatullah State Islamic University, Jakarta, Indonesia. I'm also the representative of Indonesian Public Health Association for Jakarta region. Today, I would like to present my study entitled The Potential of Community-Based Fighting Initiative Against COVID-19 in Jakarta, Indonesia. I look forward to your comments and suggestions after my presentation. COVID-19 has become a global threat and it was declared as pandemic by WHO on March 11, 2020. It has affected more than 200 countries in the world. In Indonesia, the first case of COVID-19 was announced on March 2, 2020. And the cases have increased more and more since that time. Jakarta, the capital city of Indonesia, was the first epicenter with high number of cases. Until now, 23.9% of cases are in Jakarta based on the data on the website by COVID-19 Response Acceleration Task Force. The rapid increasing number of cases were occurred in Jakarta because of the high density of population. The healthy habits at grassroots level of the community is the key of the prevention to reduce the infection rate of COVID-19. The community should have the ability, the capability to fight against COVID-19. However, their economic and social condition, particularly the urban poor, are unfavorable. So, it needs a community-based intervention to empower them. It is one of the principles of health promotion according to WHO. Empowering the grassroots might ensure the community to keep healthy and can survive during the COVID-19 pandemic. It can be done by implementing community-based fighting initiative against COVID-19. Therefore, the aim of the study was to describe the prevention behavior and the potential implication of community-based fighting initiatives against COVID-19 in Jakarta region, Indonesia. Or in bahasa, we call it Perang Akar Rumput COVID-19, Parsi 19. As for the methodology, this is the explanation. This initial survey was conducted in Jakarta region, Indonesia, using a cross-sectional study design on July 2020. 3 urban villages in Jakarta were selected as the target area of this study. Those were Karet Kuningan, Kalibata, and Duku. Using purposive sampling method, we recruited 1,177 respondents whose age were more than 15 years old and living in the area of the study. We used a structured questionnaire that contained questions about the obedience of community on health protocol for the prevention of COVID-19. We provided health promotion to the community by doing health counseling sessions. We observed the practice of washing hands and wearing masks through demonstration after they received health counseling. And the data were analyzed descriptively using statistical software. For the result, first we assess how the respondents can recognize the health promotion material that we have delivered to them. We can see that more than 90% of respondents recognize that they received the information about washing hands with soap, wearing masks, physical distancing, and disinfection. It implies that they have knowledge about these issues. Our results are supported with other studies. Study in Java Islands, Indonesia by Amari et al. Shows that 68.45% of the respondents know about the prevention of COVID-19. Another cross-sectional study in Indonesia indicated that 99% of respondents 99 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 of understand physical distancing. And a study in the Philippines revealed that 82.2% of respondents can identify hand washing as preventive measures. Regarding the adherence to preventive measures of COVID-19, the results showed that the respondent adherence were higher in wearing masks compared to washing hands or physical distancing. Study by Amari et al. Also showed that the practice was lower than respondents' knowledge. Adherence to preventive measures can be influenced by internal and external factors. Not only knowledge, but it's also another enabling or reinforcing factors such as the regulation, monitoring or supervision, logistic availability, and others. When we asked the respondents to demonstrate how to wear masks and washing hands, we found that the percentage of respondents who can do it appropriately following the guidelines was lower than self-evaluation. We also found a gap between knowledge and practice. And we can say that health promotion only is not enough. It needs a comprehensive model, namely PARC-19 or community-based fighting initiative against COVID-19. The concept of PARC-19 is developed from the concept of 5 levels of prevention by Level and Clark. PARC-19 has 5 elements of activities to empower the community facing the COVID-19 pandemic. First, health promotion, such as health education and sanitation. Second, specific protection, such as monitoring, preventive measures, vaccination. Third, early diagnosis and immediate treatment like doing testing, tracing, and treatment. Fourth, disability limitation, such as self-isolation. And fifth is rehabilitation, not only recovery from the disease, but also mitigation for social economic impact of COVID-19 pandemic. So the conclusion for our study are as follows. The initial survey shows that it was not an easy work to make people have good adherence to preventive measure of COVID-19. Health promotion by doing health counseling was not enough to encourage people to have a good practice. The role of health promotion might be improved if it is supported by other component which is community-based. Therefore, PARC-19, the community-based fighting initiative against COVID-19, could be a potential model because it enables a comprehensive health promotion to handle COVID-19. This is our references, and this is our research team. On behalf of them, I want to say thank you very much for your attention and terima kasih.